unlike some of your patients, I was going to say I'm not an aesthetic patient. I am not an only aesthetic patient because I am vain enough that I wanted a tooth, but I'm not only an aesthetic. Like I wouldn't have had an implant if I didn't have the medical issues for when the fractures happened and stuff. So, hi, my name's Rujuta and I'm one of Dr. O.P. Sodende's patients. So actually this is nearly 8 years ago now. One of my front teeth became wobbly and I didn't really think anything about it, and I'm a surgeon myself and I mentioned it to one of my friends and they were like, you're not meant to have wobbly teeth as an adult. So I went to my own dentist who then identified I had something called a resorption fracture in my dental line, in the line of the tooth that was wobbly, and she went through sort of the options and tried to make a referral on the NHS, but said that actually you can't get the treatment needed for this on the NHS. And she recommended OP to me, so I came in for my first appointment with him after I'd had an X-ray to confirm that I had a resorption fracture. And then, yeah, I went from there. So I'd been under his care anyway, after I'd had a replacement implant for my resorption fracture that had to be taken out and replaced. Oh, so during that follow-up period, in one of my follow-up X-rays or scans, OP noticed there was a bit of a resorption line in an adjacent tooth, but it wasn't wobbly and it didn't need any intervention, so it was just under monitoring. I think I'd actually come in on like October for my routine surveillance and it'd all been fine, that line was still there with no issue. And I think it was about 3 or 4 weeks later that I contacted him and said, by the way, I've got a wobbly tooth again now because I just had an accident. So he got me in pretty urgently. I was due to go back from work, go back to work for maternity leave, but during my maternity leave my infant son was playing and headbutted me and managed to catch that particular tooth on his head, and that then became wobbly. So I came back to see OP and he arranged for me to have a replacement implant for that one as well, for that tooth. So I now have 2 implants, courtesy of OP. So he was really good at trying to get me in quickly so that I could get it sorted before I went back to work. I didn't have to take a time off from work for it, so that was good. The first one in 20 something, when I had the resorption fracture that my dentist had identified, that was a referral pathway. I hadn't particularly sought out anyone in particular. To be honest, I didn't really have time because I was going through some of the stuff to do my training and exams and things. So whoever my dentist referred me to, I just came. I didn't look for anyone else.
And you don't stay in London, do you?
No, I live in Hertfordshire.
You've had to travel?
I have, yeah. I've been to, I think, all 3 different sites now that OP's been working in the last few years. So. He's very enthusiastic and very charming, which is lovely, but as a fellow medical colleague, I was more interested in whether I felt he was explaining things and I thought he was going to be surgically robust, and I had no doubts about that. I was pretty confident with the way he explained the surgical aspects of the procedure to me. So lovely to have someone nice to speak to, and that's great, but for me, more importantly, is somebody who seemed very competent, or more than competent, maybe an expert and very up to date with the current things. And I noticed that because the approach to how he did my first implant was different and improved for the second implant. So he'd obviously done the CPD and changed his practice accordingly. So in the span of a couple of years, I could see that he's developed his service accordingly. So yeah, that was good. Let me think. It'll be over about 7 years. It'll be about 7 years between the first implant and the second implant. So the first time I had the implant, the fractured tooth had to be removed. I had to have a temporary dental plate whilst the screwed implant base sort of settled into the bone of my jaw, and there had to be a period before the actual synthetic implant went in, the replacement tooth. Whereas with the second one, the tooth was removed very quickly. On the same day that the tooth was removed was a new implant screw put in, whereas there was a gap last time. And then on the screw itself, he fitted basically from my existing tooth. He created a cap from that and put that on. So my initial procedure was done all in one day, whereas I didn't have to keep coming back. And then after an interval of, must have been maybe a month and a half, I can't remember exactly how long, maybe up to 3 months, not that long. Then I came back for the formal prosthetic dental implant to be put in. So it was fewer visits and shorter time in between, and not the inconvenience, if you like, of the temporary dental plate. We had some drama around the temporary dental plate the first time around when I was in clinic myself and the thing cracked and the temporary tooth came off the plate, and I think it was on my penultimate patient. I didn't want to go into clinic the next morning with no tooth, so OP managed to fit me in and I don't really know how we managed to do it. I think he got his technicians to create a new tooth and reattach it and got me sorted, but like did it at, like, you know, late in the evening for me, so I was very grateful for that. So that was good, that was good service. Yeah, fine. Yeah, both frustrated that I needed it, but happy enough that it all got sorted in time. I'm not a particularly anxious dental patient, so I had no issues from that perspective. Just glad I've got the 2 teeth, the 2 implants, and a normal smile. That's fine. I'm very glad for that. It's good to have the 10-year guarantee from OP, although it's borderline inconvenient having to come in for the hygienist, but at the same time, actually, I think that's, you know, when I think about it from a health perspective, it's probably good that I come in to see the hygienist every 3 months, and it's good that it's the same person or the same members of the team. It's all continuous. So on balance, it's probably not that bad. And actually, when things run to time and everything's okay, it's not that inconvenient for me to come in to this part of London from where I live. In fact, this is better than where he used to be. For me, this is better. So yeah, it's all good, all good. I'd say go and visit them, have a chat with OP. I think him and his team are very thorough. They're pretty passionate, you know, about teeth, which is a nice thing. Yeah, I would recommend them. I think I actually have recommended you to a friend of mine who is possibly needing implants for medical reasons as well, and I wouldn't hesitate to recommend you again. So I think it's important to feel confident in who's treating you, so, and I do. So. I think just the fact that I could get hold of your team when I needed to, that was quite good. I appreciate an on-call service, but as soon as you saw my sort of urgent email, I think somebody got back to me, so that's good. No, I think overall everything's been pretty good. And yeah, your team are very friendly and, as I said, enthusiastic.